So, by way of introduction, my name is Ahmed. I'm a surgeon in Toronto. I trained in Southern Ontario for my entire career, and I went and worked in the United States and Virginia for a year as well to learn how to help people prevent amputation. So my goal and passion is to help people keep their legs and not lose their legs because of wounds or because of diabetes. So that's where I'm coming from. And before I begin, I'd like to acknowledge that the land that I live on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations Inuit people. And I also acknowledge that Toronto, where I live, is covered by Treaty 13 that was signed with the Mississaugas of the Credit. So really, when I chatted with Lindsay about how I can be useful to you today, she brought up a number of things, and I'm happy to add or take away from any of this. This session is yours and my time is yours, so whatever you want to talk about. But really, I'm hoping to discuss a few things. To start off, we'll chat very briefly about how blood travels around your body. That's very important to keep in mind as we talk about new things and introduce the concepts that we are going to talk about today. Angel, I see you've raised your hand. I'll get to you in a second, okay? I promise. How does diabetes harm your blood vessels, which is very important? How does high blood pressure harm you? How does high cholesterol harm you? What are all these concepts? How does smoking harm you? And what can I do, or what can you do to prevent artery problems? And the reason this is an important conversation to have is because a lot of these things, diabetes, blood pressure, high cholesterol, they're not situations that cause you to feel anything different. A lot of people have high cholesterol and they don't even know it. They could live with it for years. Same as with high blood pressure, with the exception of very few situations. Most people with high blood pressure don't even know they have it. And with cigarette smoking, it takes sometimes years before you start to feel the side effects of smoking. So that's why we're having this conversation today. So I can share with you why these situations are damaging to your circulation and to your blood. Okay, so that's really that's what's on the menu today. Angel, did you have something you wanted to say before we dive in? Feel free to unmute yourself and ask a question. Okay, so we can just put it in the chat. So let's chat about how does blood travel around the body, okay? You've got blood in your bodies, and it has to serve a purpose, right? That's why it's there. We have something called the circulation or the circulatory system. It comes from circle because things keep going round and round and round. That's how good and bad materials travel through your body. This system transports oxygen, carbon dioxide, nutrients, and waste using blood. So how does that work? Well, you've got the heart that's in your chest. Every time it beats, it pushes blood out of the heart and down into your legs, into your arms, into your neck, into your belly. It goes all over the body. With every heartbeat, it travels throughout the body in vessels or pipes called arteries. And then blood has to travel back. It comes up from the feet, it comes down from the brain in veins. So you've got hearts that beat, arteries that carry blood away from the heart, and veins that carry blood back to the heart. And with every heartbeat, that circle repeats itself. And that's why we call it the circulatory system or the circulation. Now, a lot of the conditions that I'm going to talk to you about today affect the circulation or the circulatory system in different ways. So keep that in mind as we talk about the different ways in which diabetes can change all of this. So how does diabetes harm your blood? How does diabetes harm your blood? When someone has diabetes, they have high levels of blood sugar. What does that do? Well, if you manage those blood sugars, you reduce the risk of too much damage across the body. Because when you have too much blood sugar in your blood, it starts to create many health issues. Your blood doesn't like to have too much blood sugar. We have ways in which we can decrease the amount of blood sugar in our body. People without diabetes are able to use products from their own body to control the level of sugar. But people with diabetes need help, either with medications or with injections, pills, or by changing their diet. Because if you have too much sugar, that sugar starts to attack circulation. So too much sugar decreases the ability of your arteries, those pipes, to stretch. And when that happens, they start to get diseased and then they start to get narrowed. And that can happen in any artery in your body. It can happen in your neck and brain, in your chest, in your heart, in your belly, in your leg. So all of this can be a result of too much sugar because the sugar starts to damage the inside of these arteries. And when you damage the inside of the arteries, you have a reduced supply of blood, oxygen, of nutrients, of all the things that you need in order for your body to survive. The problem with diabetes is that it's not only damaging certain types of blood vessels, it can damage any blood vessel. Anywhere in your body where blood reaches and there's too much sugar, the diabetes will start to injure that area. So that is why people with high blood pressure or high cholesterol or any of these other things, plus diabetes, have an even higher risk of experiencing complications. So we take special and extra care when someone has diabetes to make sure all of those other things are controlled properly, because individuals with diabetes are going to experience those complications with greater strength than people without diabetes. Does any of this not make sense? Do you want me to answer any questions at this point, or should we keep going? Is this all very obvious? Okay, Kathy, go ahead. You can unmute yourself. Sorry, I can't hear you, Kathy.
Thank you. Okay. Excuse me. When you say too much sugar can damage the veins and vessels, like, are you talking about like the sugar in the excess sugar crystallizing and basically ripping open the veins and vessels?
Yeah, that's a great question, Kathy. No, it doesn't quite crystallize. In fact, you're asking a really great question, because keep that thought as we talk about cholesterol, because that's what cholesterol does. But in the case of sugar, what it does is it creates an inflammation. You know, have you ever had like a blister, or have you ever fallen and gotten a really inflamed hand or leg? It's the same idea inside the artery. So it creates an environment where the blood itself starts to attack the vessel from the inside.
Okay.
That's
I have a couple of friends that are diabetic. One has actually, he's a double amputee now because of it. And his girlfriend has just been, well, not just diagnosed with, but she's had diabetes since she was a child. But she's just been told that her cholesterol level is off the chart.
Yeah.
So I want to learn about this so I can help her. I don't have diabetes, knock on wood, yet. It does run in my family, though.
Yeah. Thank you very much. This is a very meaningful, question, and I think it's really well for the next part. So, if there's nothing else, then Lindsay and Jessica, I'll look for your guidance in monitoring the chat. I apologize. on my screen. I'm not able to see it. So if there's anything for anyone to pop in, let me know. Otherwise, we'll just tackle.
Yes, thank you, Dr. Casey. Both Jessica and I will be monitoring the chat, so everyone feel free once you do, have your questions or feedback, please put them in the chat, and then we can relay them to Dr. Casey. And just a note, Dr. Casey, there is a little bit of breakage when you're speaking, so you may want to just lean a little bit closer and speak a little bit closer to the mic.
Okay, thanks.
Thank you.
Thanks. I think Lindsay is politely saying that I mumble, which I told before, but I will talk louder. Thank you. So further to Kathy's question, how can you stay as healthy as possible if you have diabetes? Okay, if you have diabetes, the most important thing you can do is control your ABC. And I don't know if anyone's heard this before, but it's commonly used. So your ABCs are: A stands for your hemoglobin A1C. That is a blood test that people with diabetes get routinely that show us how well they're controlling their blood sugar over weeks and months. So it's not like a quick test where you can take a sample of blood and it'll tell you exactly what your blood sugars are right now. Hemoglobin A1C tells you what the average of your blood sugar has been over a longer period of time. Now, why is this important? It's important because the level of blood sugar goes up and down over the course of the day. So I could measure my sugar first thing in the morning. I could check it before I sleep. I could check it halfway, during the day, and I get different values. And they're all correct values. But what's important is the average. How are you doing overall, not in any particular moment? And you need to control your A1C because it gives you a big picture of how well you're doing controlling your blood sugar. So that's A. B stands for controlling your blood sugar, and C, controlling your cholesterol. So if we can get Kathy's friends to control all of those three things, then they should be doing better than, or they can expect to have fewer issues down the road, hopefully. Darlene, did you have a question? Go ahead and unmute yourself, Darlene. I can't hear you. I'm sorry. Okay, I can't.
Oh, whoops.
Yeah, go ahead, Darlene. We can hear you. Oops, he's gone again. Okay, well, we'll get to you in a bit. So, how does high blood pressure harm you? When your doctor or your nurse tells you that your blood pressure, tells you what your blood pressure is, they're going to give you two numbers. Your doctor or nurse might say that your blood pressure is 130 over 80, or 120 over 80, or 160 over 40, whatever. It's always two numbers. And in case you're wondering, what does that mean? Why are you giving me two numbers? Well, the top number, the higher number, is the pressure inside your arteries when your heart is squeezed. So when you feel that squeezing feeling in your chest, when your heart is fully squeezed, that number is the higher blood pressure. When your heart is fully relaxed, the bottom number is pressure at that. So all the blood pressure number is the pressure inside the arteries when your heart's fully squeezed over the pressure inside your arteries when your heart is fully relaxed. That's what a blood pressure is. How does this matter? Like, why do we care about this? Well, if someone has a top number more than 130 and a bottom number more than 80, we call that high blood pressure. The term that we use in hospitals and clinics is hypertension or high blood pressure. And normal blood pressure is when the top number is less than 120 and the bottom number is less than 80. Now, why is this important? You might ask yourselves, well, look, we all have pressure in our circulation. That's how the circulation works. Who cares if it's more than 130 or less than 120? Why does that matter? Well, people with high blood pressure don't usually complain of anything. Most people with high blood pressure don't even know they have high blood pressure, but it can cause serious complications. Why is that? Well, as you have more and more force, more and more pressure on those pipes, on those arteries, over years and years and years, you start to get damage to the inside of those arteries. It's going back to Kathy's question earlier. You're not putting crystals or glue or anything inside the artery, but you're damaging it because it's under a lot of pressure. Imagine if you've got a pipe and it's constantly under very, very heavy pressure, water going through it for years and years and years. Well, at some point, the inside of those pipes are going to start to get damaged. It's the same thing with the arteries in the body. So with time, you start to get heart attacks. You can get stroke in your brain. You can get kidney disease. People with uncontrolled high blood pressure can lose function in their kidney and end up needing dialysis. You can get artery disease in the legs and get ulcers and lose your legs. So high blood pressure, even though most people don't feel anything, over many years can cause a lot of problems. So how can I lower my blood pressure? It's all good and fine to tell me, well, okay, a high blood pressure is more than 130/80, but why don't you give me some practical advice here? If your doctor or your nurse gives you blood pressure medicine, the most important thing that you can do is to take it. We know from studying a lot of people with high blood pressure that the number one problem that we face in treating high blood pressure is that people just will not take the medication. If the medications cause problems for you, don't just stop taking it. Talk to your doctor or your nurse about the problems that these medications cause. Taking blood pressure medications can keep you from having a heart attack or stroke, and it can save your life. People have studied this. I'm not making this up. And we've looked at thousands and thousands of people. And we know that when your blood pressure is controlled properly, you are less likely to lose your life or have a complication. So that's very important. Is there anything that you can do on your own to treat your high blood pressure? When Kathy calls her friends later today, can she give them any advice that does not include taking medications? Absolutely. There are many things that you can do. And by the way, the things that I'm going to share with you right now have to do with anything related to blood health. It's not just high blood pressure. So let's go through this slowly. You need to lose weight if you have been told that you're overweight. And I recognize that that's not an easy thing to do. You need to stop smoking. And we'll talk about that in a bit. You need to choose a diet that's low in fat and rich in fruits, vegetables, and low-fat dairy products. Reduce the amount of salts that you eat. A lot of people's diets are full of salt, way too much salt, especially pre-packaged meals and the really tasty stuff that you can pick up in the market. A lot of that has way too much salt in it. And try and do something active for at least 30 minutes a day, most days of the week. And try and cut down on alcohol as well if you drink more than 2 alcoholic beverages per day. So if you do any or all of these things, then chances are your blood pressure is going to improve and maybe you won't need to take as many medications. Okay? It's also a good idea to get home blood pressure meters. They sell them in a lot of places, or you can order them online. Those are things that you can have at your home. You put a cuff around your arm. They're very easy to do. And it tells you exactly what your blood pressure is. We have done studies where we looked at people who have monitored their own blood pressure. And if you are keeping track of your own blood pressure, you are better off than people who don't, because you're aware of your body, you're aware of your own situation, and you monitor closely if your blood pressure goes up, that there's something wrong. You get to the doctor or nurse sooner than people who don't monitor their blood blood pressure. So that's another thing that you can think about. Okay. So before we move on to cholesterol, are there any questions or comments about treating high blood pressure?
We do have a couple questions in the chat. One is about what if the number is lower and the bottom is higher? So what if the top number is lower and the bottom is higher?
Yeah, that's I have not seen that before, because for the lower number to be higher, sorry, unless I'm misinterpreting the question, Jessica. So the question is, what if the top number is normal and the bottom number is high?
That appears to be the question, yeah.
Yeah, okay, yeah, sure. Sorry, I thought it was, what if the lower number is higher than the top number, which you know, yeah, so that is a great question. You know, the management of blood pressure is a very complicated thing. I'm simplifying it in easy numbers just to help you guys remember some of the things we're going to talk about today. But there are many scenarios where one number is high, the other is low, or vice versa. And really, there are guidelines for all of them. So when you go and talk to your doctor or nurse about this, and they measure your number, by the way, they're not just going to measure it once. They're going to measure it numerous times to make sure they have an average as well. Just like we talked about the hemoglobin A1C and said that that is a value of blood sugar over several months. Well, it turns out that we do the same thing with blood pressure. We monitor it over a while. We make sure that we're mindful of how much your blood pressure goes up and down, and then we come up with a medication strategy that works for you. And there are many, many different medications that are used for very specific changes. So sometimes the lower number is higher, sometimes the higher number is much higher. And so I don't want you to worry about this. There are people who are trained to take care of this for you. Your job is to ask for help and seek help when you need it, and recognize that a lot of people with high blood pressure don't have any issues, until it's too late. Now, there are people who have a condition called malignant hypertension, and you don't need to worry about that. That just means a situation where the blood pressure is just through the roof. And that is an emergency. You need to go to hospital immediately for that. That is something that you will know you have, because you're going to start to get headaches. You're going to start to feel like your heart's racing. So it's not something that's subtle or that you may or may not miss. But that is very, very rare. So I don't want you to think that if you don't have those symptoms, then your blood pressure is fine. Jessica, are we good for questions, or?
There's a number of questions, but I think
Yeah.
we'll save them just in the interest of time because some are a little complex.
Okay, sure. No problem. So let's talk about cholesterol and what is cholesterol and how can it harm you? So if you guys remember Kathy's question earlier about whether blood sugars actually turn into crystals and stick to your blood vessels from the inside, and I said no. Well, it turns out that there is actually something that floats around in the blood that can form crystals and stick to the inside of the artery and cause problems. That is called cholesterol. So what is cholesterol? Cholesterol is a substance. It's something that's naturally occurring. It's in the blood. Everyone's got cholesterol. So cholesterol is not a bad thing. But just like blood sugars, if you have too much cholesterol, then it becomes a problem. Okay? In fact, it's needed. Cholesterol is needed for good health. So if you have zero cholesterol, then you have a problem, because you're not going to be able to have healthy blood with zero cholesterol. So it's actually impossible to have zero cholesterol. The problem is, just like sugars, and I mentioned that already, some people have too much cholesterol. So cholesterol travels in the blood, inside the arteries, and in people with too much cholesterol, the cholesterol starts to stick to the inside of the arteries. So going back to the pipe example, cholesterol literally blocks the pipe from the inside. You start to get more and more and more sticking to the inside of the artery. And with time, that blocks the artery altogether. People with high cholesterol have a higher risk of heart attacks, strokes, and other health problems. And in case you're wondering, I mean, there's a theme here, right? Anytime you have a condition that injures your arteries, you are getting a higher risk of heart attacks and strokes. And basically, anywhere your arteries travel, you have a higher risk of having damage there if you have any of these conditions. The higher your cholesterol, and people measure cholesterol, you get a number, the higher your risk of these problems. So what should I do if my doctor tells me I have high cholesterol? Ask your doctor what your risk of heart attacks and stroke is. High cholesterol by itself, by the way, is not always a reason to worry. You need to keep in mind that having high cholesterol is just one of many things that increase your risk of heart attacks and strokes. But not everyone who has high cholesterol needs medicine. Some people with high cholesterol can do perfectly fine with diet change or exercise. The important thing is to have it rest. It's not necessarily to take medication, okay? So should you take medications? Well, you should probably take cholesterol-lowering medicine, which we call a statin. That's the word we use for cholesterol-lowering meds. If you have already had a heart attack or a stroke, if you know that you have disease in your heart, if you have diabetes, so everyone on diet with diabetes who has high cholesterol should take a medication for it. And if you have a condition called peripheral arterial disease, what does that mean? It means disease in the arteries in your legs, which makes it painful to walk and happens when arteries inside your legs are clogged with the cholesterol. So what are we saying here? We're saying that a lot of people have high cholesterol. Some of them are able to manage it with diet, but some need medication. And if you have diabetes, then you probably should be on a medication for cholesterol. Cholesterol, unlike high blood pressure, is not something that's going to give you symptoms. No one's ever going to come into a hospital or to a doctor and say, look, my cholesterol is causing me to have the following discomfort, or my cholesterol is causing me to have a problem with my arm or my leg, because it's something that people don't experience. It's something that damages the arteries, and once the arteries are damaged, they get the side effects of this. So can you lower your cholesterol without medicines? Absolutely. You can lower your cholesterol somewhat by avoiding red meat, butter, fried food, cheese, and other foods that have a lot of saturated fat, basically all the tasty stuff. You can lose weight if you're overweight. You can be more active. And in case you're wondering, yes, I did just say that 2 slides ago. It's the same theme. You eat well, you control your diet, you lose weight, good things happen. Your blood pressure gets better, your cholesterol levels get better, your diabetes management gets better. Even if those steps do little to change your cholesterol, it can improve your health. Okay? So before we jump to smoking, anything you want me to address, Jessica or Lindsay, anything I can now, or should we keep going?
I think we are okay. There is a question about HDL and LDL specifically, but it speaks to the fact that not all cholesterol is bad, and I think you have spoken to that a little bit.
Yeah, no, absolutely. So I can chat about that very briefly. So LDL, or low density lipoprotein, that's the fancy term for that, is a type of cholesterol. So there are many different types of cholesterol. Cholesterol is just like car. Well, there are many different types of cars. Cholesterol also has many different types. And LDL and HDL are 2 different types of cholesterol. So LDL is sometimes called the bad cholesterol, and that makes up most of your body's cholesterol. HDL, or high density lipoprotein, is what's called the good cholesterol, and that you have less of that in your body. So the idea of eating better is to decrease the amount of LDL and increase the amount of HDL. That's all. And your medications help you manage this a bit as well. Okay. So I don't know if that's good, but we can get back to it later in the chat. Next, I'm going to talk about smoking. I don't know how many people smoke in your communities. I hope that it's not even a problem, but in many communities across Canada, smoking is still an issue. A lot of people smoke, too many people smoke. And smoking is a problem because it increases the risk of heart disease, but it also, unlike diabetes and high cholesterol, it increases your chances of having lung disease and cancer. So that is a big problem, obviously. How do cigarettes harm you? Well, cigarettes, when you smoke, you're inhaling all of this toxic material inside your lung. And those toxic materials get inside your blood through the lungs, and then they start to injure the artery from the inside. So it's like you have poison that is going through the air into your lung, and from the lung into the blood, and from the blood into the arteries. And it starts to injure them years and years and years at a time. And eventually, the inside of the artery starts to look like one big hunk of fat. In addition to the cholesterol buildup, the arteries become blocked completely. And when the arteries are blocked completely, you stop getting blood where it's needed. And that's how you get heart disease and artery disease and strokes and kidney disease and all of those other issues, in addition to the lung disease and cancer. So it's obviously a terrible thing, but it takes a long time to notice these changes. So that's why people don't just smoke a bit and then immediately start to have these issues. It takes years sometimes to develop. And unfortunately, by that point, you're starting to get complications related to smoking. And then sometimes it's too late. Plus, they're addictive, which we know they are. So it becomes much more difficult to quit. Quitting smoking, however, can lower your chances of getting all sorts of things, like osteoporosis, which is a condition that makes your bones weak. It can help your skin look younger if you quit. It can reduce the chances that you'll have problems, being intimate with your partners. It can reduce your chances of having all sorts of complications, as we said, in your heart, in your circulation, in your brain, in your stomach, intestine. So there really is no part of the body that smoking does not harm and that will improve within days if you quit smoking. So what should you do if you want to quit smoking? What should Kathy tell her friends who are smoking? Well, it's a good idea to start by talking to your doctor, your nurse. Why? Because smoking is an addiction. If you've been doing it for a long time, there's no shame in saying, look, I have this problem, help me. There's no shame in that at all. In fact, if you seek help, you are more likely to succeed than people who try and do it on their own. What should you do if you want to quit smoking? Well, when you're ready to quit, you need to make a plan. So set a quit date, decide, okay, look, guys, December 25th, I'm quitting smoking. That's very important. And by the way, people have studied this. I'm not making this up. Tell your family and your friends that you plan to quit. A lot of times people smoke because it's part of the social circle of what they're doing. Everyone around them smoke. And that's okay. You need to take care of yourself. So tell your family and your friends that you plan to quit. Plan ahead for the challenges that you're going to face, such as the cravings. Nicotine is addictive. You're going to have cravings. So plan for what you're going to do to manage this, and plan for potential social isolation. If everyone around you is smoking and you want to stay away from it, then that might keep you from some of your friends and some of the social activities that you're used to doing. And then try and remove cigarettes from around you. That will help. to help you succeed. If you reach out for help as well from your doctor or your nurse, then they can get you some resources, perhaps medications, perhaps set you up with counseling, which we know can help people quit and stay away from smoking. So doctors or nurses can give you advice on the best way to quit. They can give you medicines to decrease your craving for cigarettes. These medications either replace the nicotine that you would otherwise be smoking with the cigarette, or they can work on the area in the brain where the smokes make you feel better about yourself, so that you, even if you do smoke, you don't get that kick, you don't get that joy, because the part of the brain that is used to getting the joy from cigarette smoking has been shut off. So you smoke and you get no pleasure out of it. Medications can also decrease your withdrawal symptoms. What are those? Those are things that you experience when you stop smoking. So your doctor or your nurse can also help you find a counselor to talk to. And for most people who are trying to quit smoking, it works best to use both medicine and counseling. The medications help you overcome some of the things that we talked about, but you also have someone who is able to talk to you about how to get better. So the question that comes up is, well, what about e-cigarettes, or what we call vaping? Sometimes people wonder whether vaping can help them quit smoking, and that's that's a common question out there that we get all the time. However, we don't currently recommend e-cigarettes in the case of medicines and counseling. Why is that? Because e-cigarettes still have some nicotine, as well as other substances that might be harmful. So it's not like it's a completely harmless substitute or alternative to cigarettes. People who use e-cigarettes are still exposing themselves to some harm. And so it's not clear to us right now how these substances can affect an individual's health in the long term. So the answer is e-cigarettes are not a great alternative to quitting smoking. Okay, so what can you do to improve your chances of quitting smoking? Again, I don't mean to keep picking on Kathy, but what's she going to tell her friends? Well, you're going to get regular exercise, any type of physical activity, even gentle forms of movement. Even if you're able to go for a short walk around wherever you happen to live, is good for your health. Physical activity can also help reduce stress. Try to stay away from smokers and places that make you want to smoke. If people close to you smoke, ask them to quit with you or avoid smoking around you. And I'm not pretending that this is easy, guys. I'm not coming in here to preach and pretend that this is a very small task. No, this is a very difficult thing. And if it wasn't difficult, well, everyone would be doing it, right? Try and carry gum, hard candy, or something to put in your mouth whenever you're craving a cigarette. Try one, instead of putting a cigarette in your mouth, try and put candy or gum. And there are nicotine gums too that not only occupy your mouth, but also release some of the nicotine that you would otherwise be affecting. And the most important thing is, don't give up, even if you start smoking again. It takes most people a few tries before they succeed. So if you've tried and you haven't succeeded, it's okay. It's okay. Start again. Set a new date. Talk to your family again. Just, you got to keep going at it. And at some point, you will succeed. So let's wrap it up and bring it all together, and then we'll spend a few minutes engaging in everyone's questions and making sure you're all taken care of. Okay, so how do you prevent artery problems? It's the same thing I've been saying over and over for the last 45 minutes. Stop smoking, control your blood sugars and your blood pressure, get physical activity. You gotta move, even 30 minutes a day. And you might be wondering, like, where is this guy getting this number 30 from? Why not 29 or 40? Well, this is based on studies that have been done. People have actually studied this. And they found that even spending 30 minutes a day multiple days a week gives you noticeable improvements in your health, in your blood health, and in the chances that you're going to get the complications that we talked about earlier. Okay, improve your diet, less fat, more vegetables and fruit, decrease your stress, relaxation techniques, quality sleep. You know, a lot of people get very poor quality of sleep and are stressed out, especially today, especially in the environment we're living in. And so I get it, it's not easy. But again, people have studied this and have found that if you're able to relax and get better sleep, your blood health improves, believe it or not. And talk to your doctor about taking things like a baby aspirin, cholesterol pills, vitamins to supplement your nutrition. All of those things put together can help you prevent artery problems, especially if you're diabetic. Okay, so that's it for me. I'd love to engage with you for the next 15 minutes and hear all of your questions and see how I can support you.
Thank you so much, Dr. Casey. That was very informative, and I liked a number of the good points. And we have some questions here that have been floating in the chat box still. One is about secondhand and thirdhand smoking and whether it's just as harmful as smoking.
That's a really good question. I don't know who asked it. I like to address people.
That was Genevieve.
Oh, Genevieve. Okay, Genevieve. So yes, second and third hand smoking are harmful, just as harmful. They're not as harmful as if you were inhaling the stuff directly from a cigarette. But people have looked at the danger that is posed by second and third hand smoking, especially in polluted cities where people live in very tight circumstances. And yes, you have an increased risk of all of this stuff from secondhand, although it takes a far longer compared to direct person.
Okay, Angel suggests to the group that she used a cinnamon stick when she was quitting smoking.
Nice, and congratulations, Angel, on doing this successfully.
Rajesh had a question regarding diet. So he said low in fat, like trans fat, and fruits, those that are low on the glycemic index, both question mark.
Yeah, Rajesh, that's a great question. You know, full disclosure, I'm not a diet nutritionist or dietitian, okay? So I'm not going to sit here and give you false advice or mislead you. You know, in terms of the different types of fats out there, I find this stuff, frankly, confusing as well. What I would say is that if you are diabetic or you are working with individuals with diabetes, there are guidelines out there that make this very, very straightforward and easy. I mean, there are posters that you can buy that have pictures of the types of food that is good and the types of food that aren't. It's fair to say that anything deep fried, you know, or full of fat is probably not. So, you know, the fries, you know, all the good stuff, frankly, that's probably not good. And then in terms of fruits, I mean, if the issue is what type of fruit to eat, then I think you're probably in a really good state, because most people don't even take the minimum amount of that they require. And, you know, I'm guilty of that some weeks as well. So, you know, I'm not pretending to be better than anyone else. But I would encourage you to engage a nutritionist or a dietitian. And, you know, maybe for Jessica and Lindsay, that would be a great session to have in the future, like how to, you know, what kinds of food to eat. I remember I visited a community in Sioux Lookout, and they had a beautiful diagram on the wall that showed a lot of the traditional foods, and you know how they affect the cholesterol. So there's a lot of work.
Absolutely, and that's coming down the pipes. We're working on a presentation with the dietitian. Another Jessica, not myself, asks, can the blood vessels be repaired from having too high sugars? My dad is currently hospitalized with osteomyelitis in his foot, and they found that he has a heart murmur, and the murmur is new.
Yeah, that's a great question. So I'm sorry to hear that Dad's feeling unwell, and I pray for his speedy recovery. Osteomyelitis is a term that we use for an infection of the bone. So that's what osteomyelitis means. And it happens not infrequently in individuals with diabetes. And when that happens, we try and improve the circulation. That's a whole different talk. You know, if Lindsay invites me back again, I'm happy to talk to you about what vascular surgery is and how we improve the circulation. I promise to try and not mumble. But you know, that's beyond what we're chatting about today. But yes, it is possible to improve the circulation and the artery supply to the legs. It's never as good as what it was when you are born, but sometimes it is good enough to just get enough blood for the wound to heal or the infection to get better. And the heart murmurs are not traditionally things that are related to diabetes directly. So that's probably something else that's going on.
Right, thank you. And I have a few questions about statins. So can statins be harmful to those with diabetes in terms of drug interactions? And someone else asks about a familial history of hypercholesterolemia and if it's inevitable that someone will eventually need a statin. So
yeah, that's a good question. So Annette, can statins be harmful? The answer is yes. There are people who have side effects to using statins. The side effects are rare, but they're real. I've seen them. In extreme circumstances, they can harm your liver, and that's why when we start people on statins, in the short term, sometimes we'll look at how their liver is doing through blood tests. And in some people, statins can cause a condition called myalgias, which is pain in the muscles. So people taking statins will come in and say, look, my muscles are really hurting. I didn't have that before you started. So the trick to addressing this, Annette, is not to throw them in the garbage, but to talk to your family doctor or your nurse and say, look, you know, this isn't working for me. You find me another solution. There are many, many different types of statins. So I have replaced them on occasion and used one agent instead of another and worked with the individual until we found a solution that works for her. So can they cause drug interactions? Yes, there's an infinite list of potential drug interactions out there that your pharmacist will identify quickly. However, for the most part, they are a very well-tested and the benefit far outweighs the risk for most people. So I wouldn't want you to have the impression that statins are bad. And then I think it was Genevieve asking about the familial hypercholesterolemia. So familial hypercholesterolemia is just a fancy term for individuals in families who have high cholesterol because of their genes, their genetics. It's a technical term, so Genevieve is using what we call a diagnosis. It is not, thankfully, very common, but it's there. So what does that mean? It just means that you need to be extra vigilant about your cholesterol levels. There are guidelines for this. So, thankfully, we don't have to reinvent the wheel. Your primary care physician will very easily be able to identify what needs to be done and how this condition needs to be monitored. It is likely that you would need to have very close follow-up of your cholesterol levels and modification of the medication or changing in the dose to make sure that you're getting the care that you need.
Wonderful. And I think there's just one last question. Perhaps we have about 4 minutes left here, but some questions about sleep. Does diabetes affect sleep? And if good sleeping habits help, what can a person do that is only managing to sleep about 4 hours a night?
Yeah, so, it would be very hypocritical of me to give you a lecture on sleep hygiene because, my wife says I am the worst sleeper, in our entire family. Like I barely get 3 or 4 hours sleep myself most days, but that's because our kid is very young and he keeps me up all night. But I think that if you're able to get at least 7 or 8 hours of sleep a night, that has been shown to be beneficial to your mental health, to your physical health, to your stress levels. When your stress levels are high, your the blood, like the components of the blood change. You start to get different types of hormones that have been shown to actually harm you. So absolutely, if you can figure out how to get good sleep and teach me while you're at it, that I think you'd be in really good stead. And people have studied this. Does diabetes in itself cause insomnia or inability to sleep? I'm not aware of any evidence to that effect. However, very advanced diabetes in its advanced stages can affect the small blood vessels in the brain, and we know that it can cause things like dementia, vision loss, sorts of stuff, because of its effect on small blood vessels inside your brain. So it's not, completely outrageous just to think that maybe it would affect the ability to get a good night's sleep. Well, it's very, very advanced.